Traumatic brain injuries are any injuries that occur to the head. They're called an alteration of consciousness, and it can be due to a blow to the head or something we call an acceleration-deceleration event, where you were moving and all of a sudden stopped, or you were not moving and all of a sudden began to move. When those occur, you can have something called a mild traumatic brain injury, a moderate traumatic brain injury, or a severe traumatic brain injury. When you're grading types of traumatic brain injuries, you're looking at a couple different things. Whether or not you're having findings on your imaging, such as an MRI or CT scan, whether or not you're having amnesia about the day of the event or the days prior to the event. And you're also looking at the Glasgow Coma Score. For most patients, about 90% of traumatic brain injuries are considered mild. Mild traumatic brain injuries can also be called concussions. And when you're looking at concussions, you can grade those as well. A grade 1 concussion, there's no loss of consciousness. So I know it used to be old information that you had to lose consciousness to have a concussion, but we know now that that's not true. You can have a concussion without ever losing consciousness. If you did lose consciousness, but it was for less than 5 minutes, maybe it was just a quick in and out, but you remember coming to later, that would be considered a grade 2 or a moderate concussion. You can also have a severe concussion though, which means that you had lost consciousness for more than 5 minutes. And when we're looking at concussions, there's the impact and the symptoms that occur during that impact and in the days following, but there's also the chance that it might develop into post-concussional syndrome. For anyone that thinks they may have suffered a concussion or traumatic brain injury, I urge you to go to an urgent care or an emergency room to rule out anything more nefarious, like a brain bleed. For many people, though, after a concussion, the signs and symptoms will get better on their own. For about a third of people, though, symptoms will linger days, weeks, months, or even years. Those symptoms can look like brain fog, cognitive challenges. I'm just not remembering people's names like I used to, or I keep forgetting why I went into a room. It could be emotional, or I'm not as regulated as I used to be. I'm having mood swings, or my wife says I'm irritable now. It could be more physiological symptoms like headaches and dizziness and nausea, blurry vision, lack of coordination, worsening of balance. How to diagnose a traumatic brain injury? When we're diagnosing, it's really a clinical diagnosis for concussion. You're going to have your clinician analyze the events that occurred and then the symptoms that have been happening afterwards. When you're looking at diagnosing more severe traumatic brain injuries like a moderate or severe TBI, we are looking for signs on neuroimaging, like on an MRI or a CT scan. And then we're also asking questions regarding, was there a loss of consciousness? For how long? Do you remember the events that took place? And what have your symptoms been afterwards? One newer type of neuroimaging that's being utilized in some clinics like ours is the quantitative electroencephalogram. Because most concussions or mild traumatic brain injuries don't have signs that show up on an MRI or a CT scan, we had to find other investigative tools to be able to map your brain and how that dysfunction may be occurring. Electricity is the way the nervous system communicates. So being able to look at the electrical signalings of the brain allows us to then interpret which brain regions may be working not hard enough or perhaps too hard as compensation can occur. I also like looking at other diagnostic assessments, specifically the visual system and the ocular motor system. So looking at pupils, pupil size, how they're reacting to light can give us really good insight into the autonomic nervous system, or the part of your brain that's supposed to be controlling all of your automatic functions, like pupil size, sweat, digestion, and sleep. I also like looking to see how your eyes are moving, as different eye movements are correlated to different brain regions, whether it be a fast movement from one target to another or a tracking eye movement. Abnormalities and the types of abnormalities we see with those eye movements can give us greater insight into triaging and triangulating the brain regions that could be affected in your TBI. I utilize different technologies like the VOG, video oculography, to allow us to analyze and create graphs and videos of your eye movements. We also look at cognition and do a 12-domain cognitive assessment to see how is your memory. But memory is not just memory. It's a little bit more nuanced than that. We look at episodic memory, working memory, spatial, visual, verbal memories, so we can really isolate which areas do we need to focus on for you. Other components include the mental health aspects, and that's where having a team that includes a mental health counselor, someone in the psychiatric or psychological fields can be really helpful to make sure we're addressing the mental health needs as a whole person, right? Both the neurological and the mental health components are going to be brain-based components. And if your brain's injured, then you could have challenges on all fronts. Now for treatment. There's numerous treatment options out there. A lot of patients will end up resting for the first 72 hours or so after a concussion. After that, though, it's fair to get active rehabilitation. And what that can look like for each person can be different depending on the type of brain injury they have, the health that they were at before they had a brain injury. Some of the treatment options we have here at Genesis Brain Institute include hyperbaric oxygen therapy, where we're able to put you in a pressurized chamber and have you breathe in enriched oxygen so that we can speed up this healing process. There's been a lot of studies that show that hyperbaric oxygen can really help those cognitive or those memory and focus challenges after a concussion. I like following up my hyperbaric oxygen with something called photobiomodulation. It's a really cool type of treatment that allows extra energy to be given to those brain regions that need it the most. We can also do different eye exercises, vestibular rehabilitation, and cognitive training to treat the areas of dysfunction that you might be exhibiting. And then from there, looking at ways to really encompass that autonomic nervous system and the mental health piece with neurofeedback and virtual reality assisted biofeedback. One area to look at as well is the emotional component, including the PTSD that can come with traumatic brain injuries. While not all TBIs also experience PTSD, and while not everyone that has PTSD experienced a TBI, there is a lot of overlap for those conditions. They're considered comorbidities of one another, and it can make it harder to recover if you're not getting good rest because of nightmares, or you're not able to regulate your autonomic nervous system because of these flashbacks that are occurring. So being able to work with a mental health counselor that maybe has training in EMDR, or eye movement desensitization and reprocessing, as well as looking at some neuromodulation techniques like neurofeedback and transcranial magnetic stimulation, and finding the right combination that works for you. When it comes to athletes, another component that we're looking at is repetitive head injuries. Studies have shown that once you've had one concussion, that it can make the next concussion more severe. And for our groups like veterans and athletes, having multiple exposures to concussive events can occur with training, in games, or on the battlefield. Being able to have a healthy brain, or at least analyze the brain function you have currently, and then optimizing that brain function is a way to ensure that you're setting yourself up for success for a long and healthy career and a long and healthy life. There are multiple support groups for people that have concussions or traumatic brain injuries, and I encourage you to go online and create a community for other people that are going through the same thing. You are not alone. I know that this has been an arduous journey, and it can be confusing at times. But I want to let you know that there is hope out there for treatments and treatment options, for diagnostics to give you better and more accurate information of what you're going through, and that the technology keeps getting better. The research keeps getting better. So have hope that there's something out there for you, and don't give up.